everybody, Lainey Robinson here. It is 11:30, just got home from work. I'm going to make this quick. This is blog number 3 on leadership and management. I completed the leadership skills questionnaire and scored high in conceptual skills, administrative skills, and then very high in interpersonal skills. I found a care model. It's not the one that I use at work, but it's very similar to something that I would use. And to be effective as a manager, according to this, I would work with other unit managers and the director of nursing. We would all report to the administration. I would also work with nursing supervisors regarding staffing and patient admissions. So according to this care model, and it's a vertical one, I prefer that because it's much easier to follow for me. As a charge nurse, which is my usual role, I report to the unit manager, and again, regarding staffing and patient admissions, I'd report to the supervisor. However, on nights and weekends, my manager is not there, so we would go directly to the supervisor. After that, we would report to the director of nursing, and she's not there on nights and weekends, so if needed, there's always a hospital administrator on call. So I read chapter 7 in our text Leadership and Management in Nursing by Grower, Murray, and Langham from 2011. And in chapter 7, I identified 2 types of planning that I would utilize as a unit manager. I like strategic planning. Strategic planning helps your unit remain competitive, and it consolidates services so that you can reduce cost. For example, to remain competitive in the community, we could advertise that we were baby friendly, that our OB unit had lactation consultants on staff, and that after delivery you could schedule an appointment to meet with one of the lactation consultants and receive breastfeeding assistance. Another example of strategic planning would be cross-training the staff. When you work in a small OB unit like mine, it's really, really helpful if your nurses can float between care areas, move from labor and delivery to the OR for a C-section, to the newborn nursery, or out to postpartum to even take care of women's surgical patients like hysterectomies. Back to planning, I like the long-range planning. Thinking about a plan for your unit that would occur over the next 5 to 10 years. For example, we're thinking about introducing a slow transition from having a well newborn nursery to only a special care level 2 nursery, and having our babies stay out in the rooms with mom all the time. We would call it couplet care, and again, that would be part of our baby-friendly unit at our hospital. So back to staffing as a manager, that's a really important job for you, and it's important that you are familiar with your census and the capabilities of your staff. It's important to look ahead as well. I live in Myrtle Beach, so I know that in the summertime, for example, right now during Bike Week, our OB unit is really busy because we triage all of our own patients. We know that in the summertime, we're a little bit busier on labor and delivery with our OB patients as well. June and July, we have a lot of prenatals ready to go. A lot of people are going to be delivering in the next few months. And so we can look ahead. We get the prenatal records from the office, and we have a pretty good idea of actually how many of our patients are going to be term and ready to deliver in the months ahead. Also, we know that in the wintertime around the holidays, people schedule a lot of elective surgeries like hysterectomy, so it's good if we're prepared for that as well. Again, with staffing, we use the guidelines for professional RN staffing for perinatal units. This was published by AWHONN in 2010. I use this document a lot. It's thick. It's really big. I have a copy here at home. I have a copy in my locker. I use it as a charge nurse a lot of times to decide staffing for the oncoming shift, and as a manager, you would use this publication to educate your staff about the standard of care. And again, to make staffing. So what this document goes over is recommendations for high-risk labor and delivery patients. It talks about what to do with ancillary staff, different ratios, how many nurses are needed, how many patients a nurse can take. It also talks about contingency plans and goes over examples of emergency situations. It's a really important document for OB units. I also found an article called Professional Practice Models for Nursing. It's a review of the literature and synthesis of key concepts. So this article goes over 38 different professional practice models and compares the different concepts. It was really interesting read. It talks about different PPMs and how they go over shared governance, relationship-based care, decision-making. There's the theory of caring, leadership, autonomy, accountability. They all have these things in common. A lot of them also talk about professional development. And so the conclusion of this article says that the care models are all very similar and they're all evolving, but they have the same basic aim, and that is to provide structures and processes that not only empower nurses, but help us to achieve the best quality outcomes for our patients. So, with that being said, I am off to bed, and I hope that you enjoyed my post, and I can't wait to see all of y'all's, and have a wonderful week. Good night.